Jocelyn, and this morning I'm going to be giving you some information about asthma. Asthma is a lung condition where the airways become obstructed either through inflammation, muscle spasm, or excessive mucus production, and this makes it more difficult to breathe. So the picture up there shows you what a normal airway looks like and then one with asthma. And you can see just how much narrower that airway is and how much more difficult it would be to breathe. So asthma is a very common condition, and it's rising in prevalence worldwide, especially in children. Asthma affects 20 to 25 million people in the U.S., and it's the most common serious chronic illness in children. Asthma can range from mild to very severe, and doctors classify asthma in 4 different ways. So you have mild, intermediate asthma, mild persistent, moderate persistent, or severe persistent. And just to give you a range of the difference in these, with mild intermediate asthma, a patient could have symptoms just a couple times a week, and it could be exercise induced. But with severe persistent asthma, someone could be having symptoms multiple times a day, every single day. So some causes of asthma, one of the biggest ones is allergies. When you have an allergic response to something in the environment, it's basically where your immune system is just overreacting to that allergen. And so that's a big cause of asthma. Another one can be genetic, so this could be if someone in your family has asthma, or someone in your family is predisposed to having those allergies. It could also be caused by some kind of genetic mutation. Viral infections could cause asthma, so something as simple as the common cold. And inhaled irritants definitely contribute to the development of asthma, so things like pollution or secondhand smoke. And we know this because we see the highest levels of asthma in the most industrialized places in the world. Symptoms of asthma can really range depending on the person, but 4 of the most common ones are going to be wheezing, coughing, shortness of breath, and chest tightness. So a wheeze is going to be like a high-pitched whistle sound that you can hear when someone breathes, and with asthma this is going to be mostly when they exhale. And with their cough, it can be either dry or productive. Productive meaning when they're coughing up mucus. So assessments and diagnosis for asthma, one of the first things that your doctor is going to do is they're going to try to rule out any other causes for your airway inflammation. So they're going to see if you have a respiratory infection, or if you have had one recent, or if you have one right now. They're going to check for COPD, which is another lung condition that presents similar symptoms but is more serious. And then they're going to do allergy testing, specifically if you tell your doctor that you sense your symptoms coming more when you are around, say, a dog or a cat, or when you're in the grass or something like that. And then you can go about treating your symptoms more as an allergy versus as asthma. Some imaging tests will also be done, and this is just to check if there's any lung deformities or airway deformities that could be causing your difficulty breathing. And some lung function tests that will be run also in diagnosing asthma are a spirometry test and a peak flow meter. So a spirometry test tests the amount of air that you exhale, and a peak flow meter test measures how hard you can exhale that air. And these are going to be important tests because both of those things are impaired when someone has asthma. And to make these tests more effective, the doctor will conduct them before and after giving a medication. So so they can run the tests, and then they'll give you something called a bronchodilator, which opens up those airways. And if you test better the second time, you most likely will be diagnosed with asthma. And the same thing is done if your asthma's, if you think it's exercise induced. So you'll run the test, do some kind of exercise, and then if you test worse, you'll most likely be diagnosed with asthma. So asthma doesn't necessarily go away. In some people it does, but it is treatable. So the goal of treatment is to prevent flare-ups and to reduce symptoms when you do have a flare-up. So this is done through short-term and long-term medications and avoidance of triggers. So your short-term medications are going to look like those bronchodilators that I referenced earlier. So that's going to be most likely albuterol, which is in those inhalers that you sometimes see people have, and so those will be for those more acute situations. And then long-term medications can be oral medications, or they can be things that you inhale daily that will just overall reduce inflammation in the body, specifically in those airways. And then avoidance of triggers is going to be really big for asthma treatment. So that's going to be avoiding things like being outside when it's really cold, since cold air can inflame those airways, avoiding strenuous exercise, and avoiding specific allergens in the environment that you can tell make it worse. For more serious flare-ups, so if someone's treatment is just not working, or they just have a more serious case of asthma, they may need to be admitted into the hospital to have oxygen therapy, and to be given fluids, and that's going to decrease that mucus production and hopefully decrease that inflammation. So because asthma is so common and because such a huge part of treatment is limiting triggers, the public service announcement portion of my presentation, I'm going to be talking about some more non-medicine ways that you can reduce the possibility of a flare-up. So one of these is going to be using an air conditioning. That's going to lower the amount of pollen that gets into the home, and so that can really help. Dusting your home often, using a dehumidifier if you live in a humid place, preventing mold, that can be another one of those inhaled irritants that can cause inflammation, avoiding secondhand smoke, reducing pet dander, so that's just when your animals shed and that kind of thing. Wearing a face mask when it's cold, and that's just going to help warm the air as it comes, as you breathe it in. Reducing anxiety levels is going to be big, whether you're in an asthma attack or you might be getting one. That can be big. Getting a good support system around you so that you don't feel like you can't do as many normal things. And then just maintaining overall health and trying to not get any respiratory infections. Prognosis for asthma is really good as long as you avoid triggers, you overall just stay healthy, you're consistent with the medications that your doctor gives, and you know when your condition is worsening. And going to your follow-up appointments is also going to be big, and those are just so that your doctor can help you to see if your condition is worsening and if your treatment options are continuing to be effective. So if you want any more information on asthma, this is where I got mine. And yeah, thank you.